Good day, everyone. Uh, my name is Mr. ABUBAKAR JINU MOHAMMED. I'm the one taking hematological disorder. So I want to continue from where we stopped in our previous lecture. In our previous lecture, we discussed the overview, anatomy and physiology of blood, and we also discussed the assessment of how we can be able to assess a client with hematological disorder. And then we also discuss on diagnostics evaluation. I guess that is where we stopped in our previous lecture. Today, we are going to discuss on the disorders of hematological disorders of hematology. Number one, we have anemia. Number two, we have hemophilia. Number three, we have myeloma. Number four, we have myelodysplastic syndrome. We also have polycythemial vera, and we also have antiphospholipid syndrome, and we have idiopathic thrombocytopenic purpura. And then we also have lymphoma, and we have thalassemia, and we have thrombocytopenia, and then we have acute lymphocytic leukemia, and then we have acute myeloid leukemia, and then we have chronic lymphocytic leukemia, and we also have disseminated intravascular coagulation, and we have hematochromatosis, and we have chronic lymphocytic leukemia, and we have Fanconic anemia, and we have hemochromatosis, and we have platelet disorder, and then we have recurrent thrombosis, and we have thrombocytopenia. All these items, they are hematological disorder. I will repeat myself again. I said we have anemia. And I believe even this anemia we are referring to, where we have different types of anemia again that will be lead to this. Like we have iron deficiency anemia, we have sickle cell anemia, and we have hemophilia, we have aplastic anemia, we have hemolytic anemia, and I said we have a myelodysplastic syndrome, and we also have myeloma and polycythemial viral, and we have anemia of chronic disease, and we have antiphospholipid syndrome, and we have lymphoma, and we have thalassemia and thrombocytopenia, acute lymphocytic leukemia. We also have acute myeloid leukemia. We also have chronic lymphocytic leukemia, and we have disseminated intravascular leukemia, disseminated intravascular coagulation, and we have Fanconic anemia and hemochromatosis anemia, we have hemochromatosis. Then we have chronic chronic lymphocytic leukemia, we have disseminated intravascular coagulation, and we have Fanconic anemia, and we have chromatosis, and we have platelet disorder and recurrent thrombosis, and then the last one we have thrombocytosis. All these items, they are hematological disorder. Now we are going to take it one after the other. We are to start with anemia. We are to start with anemia. Anemia. If they said anemia, it is also called lack of blood. Anemia is decreased in blood cell. We can define anemia. We can say anemia is a condition in which the blood does not have enough healthy red blood cell. We have numerous definitions of anemia. I said anemia can be defined as a condition in which the blood does not have enough healthy red blood cell. Or we can also define anemia. We can say anemia can be defined as decrease in red blood cell, Now, anemia results from a lack of red blood cell or dysfunctional red blood cell. I said anemia results from a lack of red blood cell or dysfunctional red blood cell in the body. This leads to decreased in oxygen flow to the body organ, which leads to decrease in body flow to the body organ. We have some signs and symptoms of anemia. Number one, we have fatigue. Number two, we have pallor. We have skin pallor. Number three, we have shortness of breath. We have light-headedness. We also have dizziness, or we have fat heart rate. We also have confusion. We also have general body pain. We have ataxia. So all these, they are signs and symptoms of anemia. I said we have fatigue, we have skin pallor, we have shortness of breath, we have lightheadedness, we have dizziness or fast heart beat. And we also have confusion, we have general body pain, and then we have ataxia. Then we also have ataxia. Then what are the main causes of anemia? Causes of anemia. In a nutshell, if they said causes of anemia, anemia can be caused. Someone can have anemia due to some certain factors. Example, causes of the anemia. We have malnutrition, lack of environmental sanitation, lack of exercise. Yes. We also have loss of blood. We also have inheritance, and even drug toxicity. All these, they are causes of anemia. I said the causes of anemia, we have number one, we have environmental factor. We have malnutrition. We have malnutrition. Apart from the malnutrition, we also have heredity. Apart from the heredity, we also have loss of blood, and we also have drug toxicity. Now, we also have drug toxicity. Now, we define what anemia is. We also talk on the signs and symptoms of anemia, and we also talk on the causes of anemia. Now, what are the types of anemia? The types of anemia. We have plenty. We have many types of anemia. Number one, we have iron deficiency anemia. Types of anemia. We have iron deficiency anemia. Number two, we have vitamin deficiency anemia. Vitamin deficiency anemia. We have aplastic anemia. We have hemolytic anemia. We have microcystic anemia, and we have congenital anemia, and then we have sickle cell anemia. And then other types of anemia include thalassemia anemia. We also have megaloblastic anemia and pernicious anemia. So all these, they are types of anemia. Even hemolytic anemia, even idiopathic aplastic anemia, which we have. So all these, they are types of anemia. Now, if we said the iron deficiency anemia is a type of anemia that occur. When there is decreased in red blood cell. Now, what am I referring to as decrease in red blood cell? When there is decrease in vitamin B12. When there is decrease in vitamin B12, then likewise, such person will have we undergo iron deficiency anemia. But before we talk on the types of anemia, then we also have some stages of anemia. And these stages of anemia is of three. We have mild, we have moderate, and the last one, we have severe. The mild anemia is a type of anemia that will occur, but after some time it will be off. You will not express such. But the moderate, like the anemia is there, but it's normal. It's not that too far. And then the severe. If they say the severe type of the anemia is a type of anemia, is a type of anemia that someone have, which is very, which is what? Which is very chronic, which is very, very what? Chronic. For you to might escape from this stage of this chronic anemia, then you need to undergo series of what is called medication. You need to undergo series of medication. So as I said earlier, I said we have 3 stages of anemia. We have the mild, we have the moderate, and the last one we have the severe. Now, from our other what we call yes, then okay, let's discuss on the types of anemia. I said we have iron deficiency anemia, and I said it's a type of anemia that occur when there is what decreased in blood volume. Now, the number 2 now is what? Is hemolytic anemia. Hemolytic anemia occur due to the destruction of red blood cell. It occur due to what? Destruction of red blood cell. In this phase, there is impaired red blood cell production and defective proliferation and differentiation of stem cell. And then the other phase, we have megaloblastic anemia. Megaloblastic anemia is a type of anemia that is characterized by very large red blood cell. It is characterized, for example, this megaloblastic. When someone, for example, if you have a client and you discover that this particular client is being characterized by very large red blood cell deficiency, then you can categorize this with what? Megaloblastic anemia. Then the other phase of it, we also have the other types of the anemia, which is what? Aplastic anemia. If they say aplastic like the aplastic anemia is of different types too, but this aplastic anemia is a type of anemia that specifically is to affect the bone marrow. So that is where you see this what is it called, this aplastic anemia. Then okay. Then in another type of the red blood cell, in another type of what is it called, the aplastic anemia. But this aplastic, I told you, it occur when bone marrow does not produce enough blood cell. That is what? Aplastic anemia. Then this we have another one called hemolytic anemia. Hemolytic anemia is a type of anemia that occur when there is breakage or downfall in red blood cell, is what is referred to as the hemolytic anemia. Then we have microcystic anemia. This microcystic anemia is a type of anemia. It occurs when the red blood cells are smaller than normal due to the low hemoglobin level. That is what is referred to as microcystic anemia. I said when red blood cells are smaller than normal due to the hemoglobin level is referred to as microcystic anemia. Then another types of anemia is sickle cell anemia. Is a condition that affects the genes. Is a condition that affects what? The genes. Then the next one we have thalassemia. The thalassemia is is a type of anemia that attack immune system as a result of lupus. This can happen to anyone when a baby is still in the womb or a newborn. That is what is referred to as the thalassemia anemia. Then that is what is referred to as thalassemia anemia. Then now, if you have such clients with this, anemia, then how will you treat such patient with anemia? How will you treat a patient with anemia? The nursing management on anemia. The first thing you do, provide privacy. Number two, reassure the patient. Reassure the patient. Then place patient on comfortable position. You need to authenticate the patient. On what? How will you authenticate the patient? You need to authenticate the patient on what class or what is called food will he eat. And you also need to authenticate the patient to be taking his or her drugs at the right time and at the correct dose. The next thing you need to do, you also need to administer medication. What are the type of medication you can administer to such patient? You can administer iron, vitamin B12, or folate as prescribed. You can also give ceftriaxone injection or shalbatan injection. You can also help the patient to promote his or her diet. Now, you as a nurse, you need to play a role by telling the patient or the client to promote or to take enough iron, enough vitamin B12 and folate. Because all these items, they are what will boost the patient or the client's immune system. Then you also need to manage the patient's symptoms. You need to manage the patient's symptoms. You as a nurse, you need to ask serious questions. You need to ask questions from your client. that how do you feel? If the patient said I'm having headache, then you give medication that is in concern of the headache and etc. Then you also monitor. You also need to monitor laboratory. What am I referring to as laboratory? Like the monitor labs, like the oxygenation and then the blood transfusion. Because there like so in some cases, if patient is lacking blood, you also need to check the patient further to check the PCV. If you discover the blood is low, the blood is shorting, then that particular person needs to be transfused with blood. Then provide emotional support. Provide emotional support. It's very, very vital for you as a nurse or midwife. Then the next thing is what? Collaborate with the health care team. You need to collaborate with them so that their own aim should not be defeated. Then in summary, we discuss on anemia. We discuss on anemia. We discuss on disorders of hematological, and I said number one disorder we have iron deficiency anemia, we have sickle cell anemia, we have hemophilia, we have aplastic anemia, we have hemolytic anemia, we have myeloma and polycythemia, and we also have lymphoma, thalassemia, and thrombocytopenia, acute lymphocytic leukemia, and then we have chronic lymphocystic leukemia, and we have Fanconic leukemia and hemochromatosis leukemia. Now, anemia. So then from there, we also discussed on the anemia, and we define what anemia is. I said anemia can be defined as decrease in red blood cell. Some other people also said anemia, it is also referred to as lack of blood in human body. Then from there, we also discussed on the symptoms, signs and symptoms of anemia. Signs and symptoms of anemia, which I told you, we have fatigue, skin pallor, shortness of breath, lightheadedness, dizziness, or fat breaths. And I also tell you, I said anemia results from lack of red blood cell or dysfunctional red blood cell in the body, which may lead to decreased oxygen flow to the body organ. Now, the causes of anemia, I say lack of environmental sanitation, malnutrition, aged, heredity, infection, even infection. Even infection can also be a factor contributing to, and then drug toxicity. All these things, they are causes of leukemia. And then what is it called? The signs and symptoms: tiredness, weakness of the body, short breathing, regular heart beating, dizziness, chest pain, and cold chest, and also fatigue, and lightheadedness, and then general body pain, and then shortness of breath and skin pallor, and then skin pallor. Then the nursing management. In the nursing management, nursing management. I said, number one, you need to reassure the patient. You need to reassure the patient. Then you need to promote emotional support. You need to provide emotional support. Then you also need to educate the patient on nutritional diet, and also you also need to instruct the patient to promote what is it called, to be eating iron food, folate, vitamin B12, and etc. Then you also need to monitor the patient laboratory investigation, that is the PCV. You also need to check if the patient pack cell volume is low, then such patient need to be transfused with blood. Then after transfusing such blood, you also need to still repeat what is it called, PCV again, to check if the blood increased or not. So gentle ladies, we will call it a day. Thank you, and God.
This